The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Now, before we get started, I'll introduce our speaker. Robert Hendren is Director of PRONTO Research Lab and a medical consultant to the STAR Autism Clinic. He's also co-director of the Dyslexia Center at the University of California, San Francisco. He's published more than 100 scientific papers and 4 books and has been listed in the Best Doctors of America each year since it was first published in 1996. His current areas of research and publication interests are translational clinical pharmacology and nutritional trials using biomarkers in neurodevelopmental disorders. These webinars are made possible through generous donor support. If you would like to contribute, please visit our website at autism.com. And now, I will turn this over to Dr. Hendren.
Thanks. It's a pleasure to be here today to talk a bit about things that we could consider that could improve the risk factors if someone is thinking of getting pregnant or is pregnant and wanting to do whatever they can to not have a child with autism. Sometimes that's people who have already had a child with autism. Sometimes it's family members who worry that they have a genetic history. Sometimes it's people who might have been exposed to things that make them worry, or people that just want to make sure that they're doing everything to have the healthiest possible outcome from their pregnancy and thinking about risk factors that might lead more to autism. So to disclose, and I'm not planning to discuss many of these today, but that I have research grants from a number of different pharmaceutical and other companies. I'm on advisory boards for some of these, and I'm a reviewer for a number of grants that you'll see listed in my disclosures. What I hope that we're going to do today, or what I plan to do, is to update all of us on the latest understandings about the neurodevelopmental underpinnings of ASD and how we understand that it might develop. To review the possible perinatal factors, factors that occur before, during, and after pregnancy that are associated with the later development of ASD, and to identify the evidence that's available for some interventions which may prevent or improve the outcomes related to autism spectrum disorders. So when we think about the brain and how the brain develops, it begins with an interaction between genetics and with the intrauterine environment, and it expresses itself in a variety of ways through embryologic processes that start at the back of the brain and go forward, that go through gray matter and then white matter ways that the nervous system grows. There are certain brain regions that grow first and grow later, developmental processes like pruning back of some of the neurons, myelinating some of the neurons. And there's ways that a particular temperament or style in the child or infant, but also even in the parent, begin to interact with this growing brain and nervous system. There's neuromodulators like neurotransmitters and neurohormones and other influences that eventually come to the postnatal environment that can influence healthy or more pathologic development. So there's a lot of places where these factors can play out, and a lot of places where we could make hopefully helpful interventions that make a difference in how people do. So to carry that on another step in thinking about neurodevelopmental theory, we know that brain development's a continuous process. It's something that starts from the moment of conception, and it goes on and is active until we die, but it's most active in our first few years of life, but continues to be noticeably active well into our 20s. There's early genetic and environmental factors that may make the brain vulnerable. Those genetic factors or things in the environment are things that we're going to talk a little bit more about and then get into things that we can hopefully do to improve the outcomes to the very best possibility. These pre-existing brain abnormalities interact with things that happen later too, to result in a mental disorder, which is neurodevelopmental theory, or in this case, autism. And all of that, while it suggests vulnerability, it also suggests that intervention can positively influence brain growth, that there are things that can happen that lead things to go in a not so healthy way, and there are things that we can do that lead things to go in a healthy way, somewhat like staking a plant or putting a cast on a leg. We all know that autism has been growing. I think there must be a slide that shows this better because this only goes to 2007, but we know in figures that go up to 2012 and beyond that the incidence is as high as 1 in 68 children if we're talking about both boys and girls, and even less than that if we're talking about only boys. When we say that the prevalence is growing, generally that means we don't fully know why, and we'll talk about some explanations, but it says that generally at least incidence, the number of new cases, would not be growing if it were purely a genetic disorder. And most studies indicate that this is not solely a factor of prevalence, the number of recognized cases, but it also shows that the actual incidence, the number of new cases, is growing, and we couldn't explain that as solely a genetically passed on from generation to generation type disorder. So the explanations for this increase include, well, we're diagnosing it more, or we're using other terms that we used to use, like mental retardation or schizophrenia, and now we're calling it autism. There's better reporting, so we're counting it more. There's increased recognition. People didn't know it before, or people moved to areas where they're more likely to count autism, so we're seeing a higher amount. But most studies indicate that those factors don't explain all of the increase that we're seeing. Increasingly, people are saying that at least some of this increase is due to things like environmental toxins, infectious or immune vulnerability, or epigenetics, changes in the way genes express themselves based on their interaction with other genes or with the environment. So in a kind of simple way, when somebody says, what causes autism, we can start by saying, well, there's a first hit, which is a genetic neurodevelopmental vulnerability. There's a second hit, which is something in the environment that stresses the system, that interacts with the genes to produce changes in the way genes express themselves and begin to lead to the development of autism. The third hit comes when we say, well, there's really nothing we can do about it, or it's a disorder that is set in your genes, or once it's gotten going, we can't change the course. And years ago, we used to say that, and it used to be more true because we didn't do those things that might improve that interaction and improve the eventual outcomes. So we know that there are multiple genes. Early on, people thought, oh, maybe we'll find one gene or 2 genes or 5 genes, because we know that identical twins have a 60 to 90% opportunity of developing autism in both, whereas fraternal twins, twins that come from different eggs, have more like a 0 to 36%, and siblings have somewhere between 4 to 19% depending on the study. But at best, we've only been able to find that 25% of people who have autism have a clear genetic etiology. That number is growing, but for the most part, there's an increasing acceptance that there are hundreds of genetic mutations, some of which have not ever been seen in the parents or not been seen in even generations, although it can be something from generations, that lead to these de novo mutations and lead to ways that say we could develop autism, but perhaps we could also treat autism by influencing the way those genes are expressing themselves. There are some factors that we know pretty clearly are related to autism, and yet there are others that there are theories that have, almost as many proponents as there are ideas. But the documented things that are clearly related to autism are things like viral infections, rubella like measles, or valproic acid, Depakote, during pregnancy, or thalidomide that used to be taken years ago during pregnancy, and both as a sedative or an anti-anxiety agent to help with those, but came out with kids that had little flipper-like arms and legs. But if the mother took thalidomide during the end of the first trimester of pregnancy, there was an increased chance of their offspring then having autism. But the proposed influences are many, many, like the influence of mercury, which are associational but have stronger evidence, lead, which seems to have strong evidence, certain environmental toxins, and we'll talk about these as we go through this talk. Vaccines, which is still controversial in some people's book, but in others say no, and especially not since thimerosal has been removed, but also things like lack of vitamin D. Parental age, and we'll talk more about that in a few minutes, is associated. Maternal metabolic conditions, influenza or fever, and genetic susceptibility, which we'll talk more about as we go through this talk. There are environmental pollution factors that, while we don't see them in totally cause and effect, we know that this happened, and as a result, this person developed autism, but they're more associational, that there may be mediating factors between things like environmental mercury release, but there have been good studies showing that if you live downwind of a coal-burning plant, that the chance that you're going to develop special ed problems and autism become much higher. And that study's been shown in several replications in Texas. Or that children with autism are more likely to be exposed to traffic-related air pollution, particularly if they seem to live near places that produce a lot of diesel exhaust. And that study has been replicated a number of times. In studies done in the Central Valley of California, if you live near places where agricultural pesticides are sprayed, there's a higher incidence of autism. And as I've mentioned, traffic-related air pollution seems to make a strong case for volatile organic compounds in phthalates. So kind of in summary, and what will kind of come up again and again as we go through this talk, is that the susceptibility to autism has moderate genetic heritability, and if we look at shared gene environment, shared twin environment factors, that we can begin to understand better that there is a role that the environment plays. That we're looking at spontaneous coding mutations of large number of genes, which increase the risk by 5 to 20 times, meaning that these were changes in genes that weren't seen in the parents, but were seen now due to some factors that have affected the way the genes are expressing themselves in this infant that's at risk or has autism. And that genes that tend to get inserted in, or parts of genes that do, in creating these de novo mutations, are associated with autism and carry a fairly large effect. In a large study done in Sweden, individual risk of developing autism increased with genetic relatedness, but the heritability of autism and autistic disorder were still only found to be 50%, with the environment playing another 50%, the number of which has been replicated in a number of studies. So we think about, how do we understand this? How do we understand autism, and what's this thing that I'm talking about in terms of gene expression? When we first started thinking about autism and other kinds of disorders, we kind of looked at the surface. If we might think of it even as a slice through the center of the earth, saying the surface is what we see, the symptoms. And I think we thought at first that the core of the earth would be DNA, the way that the course of autism is there, and we'd find it in the DNA. Rather, we're finding that it actually is this part in the center which seems to be the endophenotype and shows where DNA is expressing itself to be seen then in symptoms. I've sometimes thought of this as a little bit the way people grow wine, or the way you hear wine producers talk about their terroir. They're talking about how much clay and how much lava and how much other sand and other kinds of factors play a role, but they also talk about how much rain and how much sunshine. And some places people even talk about the loving care that the people tilling the soil gave to that land, which is a little the same way that we grow brains. So I think of it as the terroir model, and thinking about how do factors at any of these levels affect these basic levels, and how do they affect the way the brain is progressing and growing, and how can we then create better soil, or terroir, if you will, to help children grow healthy brains. That part of the terroir that we think about is being shown increasingly in studies to include things like immune abnormalities and inflammation. Some of the references that you'll see here through this are a few years old, but I found them to be the best summary of what each of those are, although there are more recent studies replicating these ideas. Things like oxidative stress seem to increasingly play a role in understanding things like autism, but also cancer and vascular disorders as well. Disturbed methylation play a role. Mitochondrial health, the little energy bunnies that drive the metabolism of the cell, can show abnormalities. Disorder, mitochondrial disorder, is somewhat rare, but dysfunction is found in sometimes as many as 30% and maybe more of young people with autism. Free fatty acid metabolism, excitatory inhibitory balances between the different neurotransmitters, and then various hormonal effects all play a role. The thing that's hard is to know when are those processes active. So if we're talking about oxidative stress and we're going to treat that, we need to have some kind of a biomarker that would say, well, oxidative stress is playing a factor right now, or maybe that's associated with inflammation, but it hasn't yet affected things like free fatty acid dysregulation or mitochondrial dysfunction. So if we're targeting those things, they wouldn't show changes in the same way. But that's where the science is starting to go, is to say, when can we know this process is active? By hopefully finding metabolic biomarkers that we could say, rather than just shotgunning it, trying everything, we can try more targeted interventions. But at this point, we're still kind of shotgunning it, and that's what we're going to talk about now in terms of what things are safe and potentially effective in trying to improve outcomes in pregnancy. If you just Google, can autism be prevented? You'll find there are a number of places that come up with ideas. The Autism Research Institute, who's hosting this webinar, has some good points about what might be done to help prevent autism. It's not a prescriptive kind of thing, but it says here are some ideas. And they're based a lot on the last bullet there, Maureen McDonald's recommendation, a nurse who gives very thoughtful kinds of suggestions. The website My Child Without Limits has some good ideas. David Berger is a practitioner in Florida that also lists some ideas and has a program to work with family members to try and improve their outcome. And we'll talk more of these as we go through this presentation. The recent studies talk about how prenatal experiences exert their influences on this epigenomic information that aren't in the actual DNA, but they're seen in that next level up, in methylation and chromatin patterning, in non-coding RNAs, and in the mitochondria. So we're getting from the center of the earth into the middle of the earth, and that these transgenerational epigenetic effects, things that could even be passed down and skip a generation, but could start in one generation and then show up again a generation or two later, are things that can also affect conception and to the developmental trajectory of the embryo and the fetus, and then looking at the lifetime health of the child. So one of the factors that seems to get the most attention looks at diabetes and weight. It's not a simple association, but there have been a number of good studies suggesting that pregestational and gestational diabetes is associated with autism, learning disorders, and with ADHD. But the association isn't 100%. It's not like every kid with autism had a mom who had diabetes, or every mom with diabetes has a child with kids with autism. There seem to be a number of factors that could be influenced and that are more or less predictive of that association. There's also increased diagnoses of developmental delay and autism in children of mothers who are obese, which may be one of those factors associated with diabetes. If you're way overweight and you have diabetes, that doubles your or increases your risk. But there are other factors as well. Some of those proposed mechanisms include things like maternal diabetes, increased fetal oxidative stress, inflammatory processes which can go along with diabetes, epigenetic changes in gene expression, and neurodevelopmental changes that are directly induced by hyperglycemia. There are also factors that relate to autoimmunity, the association of autoimmune and infectious factors such as rheumatoid arthritis, systemic rheumatoid erythematosus, antiphospholipid syndrome, celiac disease, idiopathic thrombocytopenic purpura, myasthenia gravis, are all associated with autism in the offspring. These autoimmune disorders seem to have a higher incidence, and Judy Van de Water and her group at the Mind Institute have shown repeatedly that this anti-fetal brain antibody has been found much more frequently in mothers of children who have autism than in mothers of typically developing children, and that anti-fetal brain antibody is also associated with type 2 or gestational diabetes. Other factors that are associated include things like age. Older women who are deficient in iron have 5 times the risk of having a baby with autism. There seems to be a significant risk in mothers, and again this isn't shown in 100% of the studies, but in many of the studies, in mothers who are over 35 or in mothers who are under 20 years of age, and that the relative risks increase with increasing maternal age. That also interacts with paternal age, so there's triple the risk for autism when fathers were older than 45 years versus fathers who were 20 to 24 years old. And if you combine older fathers with older mothers, the risk goes up beyond what one or the other has by itself. There are also things like infections and birth factors. The strongest association is with viral infections like rubella. We mentioned those before. Also with things like cytomegalovirus, which isn't as strong as rubella, but still is there as a risk factor, and influenza, which is, as we'll mention in a later study, still a risk factor, but not to the same strength that something like rubella or measles is. In a Swedish birth cohort born between 1984 and 2007, large number of cases, they found that 3.7% of the autism cases versus 2.6% of non-autism cases had mothers who were hospitalized for infections sometime during pregnancy, saying somehow the mother had an infection serious enough that she needed to go to the hospital, and that increased her risk of developing autism in her child, or her child developing autism. Perinatal steroid perturbations, things that increase stress, things that increase the production of steroids, also seems to increase risk. And then things like preterm births, small for gestational age, and C-sections are also associated with an increased risk. Not 100%, so there are factors that might play a role, and there are some of those that people are trying, like exposure to the flora of the perineum after birth rather than just taking the C-section out and not exposing, or a variety of other things that are more anecdotal reports at this point, but may have some benefit if we were to see that it wasn't just the section, it was other things that mediated that association. So we'd also talked at the beginning, but again here without going into extensive review, that there are environmental factors, toxins from the environment, that include things like air pollution, organophosphate pesticides, and heavy metals that all seem to play a role in the development of, or in the association with autism in the offspring. Other chemicals like polychlorinated biphenyls, bisphenols, phthalates, things like fire retardants have been one, the lining in thermos bottles have been another. But then things like toluene, lead, methylmercury, and arsenic have all been implicated in developmental neurotoxicity, not necessarily directly related only to autism, but saying these things are neurotoxic. They affect the way the brain's growing and developing as an infant, and but as a fetus especially. And yet, a study showed that few doctors warn expectant mothers about these environmental hazards. In a study that was done recently, 78% of a large number of obstetricians, that large number being a 14% response rate, but still a large number, agreed that they felt they could reduce patients' exposures to environmental health hazards by counseling patients. But 50% said they rarely took an environmental health history, and less than 20% reported routinely asking about those exposures found in pregnancy, with only 1 in 15 saying they had had any training in the topic. When they were asked, why didn't you share this, or why didn't you at least talk to patients about this, they said, well, they felt like they didn't have a good knowledge, they were uncertain about the evidence, they were concerned about whether patients could really reduce their exposure to harmful exposures, and they might be fearful that they would cause anxiety among patients. But for doctors who do discuss this, they talk to them about whether they live near fields where pesticides are sprayed, whether they work in a plant where there might be any kind of toxins that are used in that plant while the mom is thinking of getting pregnant or pregnant, and what could they do to avoid that. And a variety of other factors that can come just by asking, even about things in the home. Some people are concerned about new carpet. Some people are concerned about living too near other kinds of places that might be toxic. And while the evidence may not be totally strong for parents trying to play it safe, there is a way that it's, if one is aware of it, relatively easy to think of ways to avoid it. There are also medications that might be taken during pregnancy that could increase the risk. things like Depakote, as we'd mentioned, valproic acid, certainly thalidomide, but misoprostol. SSRIs is a controversial one. Some studies suggest that they're not associated with an increased incidence of autism. Some say that they are, but most studies conclude that the risk of a mother being very depressed during pregnancy has to be weighed against whatever the purported risk for SSRIs are for pregnancy. Recently, there have been several studies, 3, that talk about acetaminophen in pregnancy perhaps being associated with a higher incidence of autism. The studies would indicate that that's so, even in large numbers of patients, but many experts feel we haven't replicated this enough to say with great assuredness that pregnant mothers should not take acetaminophen, but conservative doctors and conservative mothers might think of avoiding it. The relationship between maternal alcohol consumption and autism has not been clear, but there has been a clear association between maternal alcohol consumption and the association with psychopathology. There have been a few studies of the association of alcohol consumption and offspring that have autism spectrum disorder, enough to suggest that it's probably not a good idea, especially when it's known to affect brain development in ways that would suggest even moderate amounts of alcohol could have a bad exposure. And so for a variety of reasons, it might be a good thing to avoid during pregnancy. There have been studies looking at prenatal exposure, perinatal exposure to cocaine, which show that it can cause things that are associated with autism, like preterm delivery, intrauterine growth retardation, placental removal early and causing premature labor, stillbirth, and death, which are all factors that could be avoided. So interventions that can improve outcome include things like folate. That's probably the one that we have the best evidence for. So higher maternal intake of certain nutrients and supplements reduce the risk for different kinds of neural tube defects, as they're called, but also for autism especially, with the best evidence for supplementing with folic acid. The CHARGE study, which is a study that is being done and has been done at the Mind Institute for a number of years, showed that mothers of 429 children with autism had less folic acid intake than mothers of typically developing children, which would suggest that folic acid plays a role. But in a study done where maternal multivitamin was taken 3 to 5 times a week, was associated with a higher risk of autism, but if mothers were found to have high levels of methyl B12 or high levels of folate, I mean exceptionally high, that was associated with an increased risk of autism. So supplementing is a good idea, but saying more must be better is probably not a good idea, trying to take a lot of supplements, particularly when they're methyl B12 or folic acid, that are not as easily cleared in high levels, may make a difference in the offspring. Omega-3s are beginning to have an evidence for making a difference. They are also called polyunsaturated fatty acids, PUFAs, and they regulate membrane fluidity and synaptogenesis, neurogenesis, growing neurons, neurons connecting to each other, and neurotransmission. And they're also precursors of molecules involved in the immune process, particularly microglia, these little glia that eat up things that are potentially inflammatory, causing or leading to immune problems. The omega-3s were associated with a decreased risk of autism, whereas omega-6 have been shown to be harmful. Omega-3s seem to be more common in things like the Mediterranean diet or people that eat a lot of fish, whereas omega-6s are more common in people that eat the so-called Western diet or things that are high in meat. But overall, omega-3 supplementation shows benefit in some studies, but stronger evidence is needed. The studies say, yeah, it looks like it helps, but we need more studies over a longer period of time to be able to say with great assuredness that giving omega-3s during pregnancy improves outcome. Vitamin D is another that is a kind of active neurosteroid that appears to be neuroprotective. In a study of a large number of mothers who were found to have deficient 25-OHD, which is the vitamin D3 level that we get, and it was, in this case, lower than 25. They had higher scores on the social responsiveness scale, one of the scales that's often used to assess autism, and has a variety of scales that are used at times too in saying that in making the diagnosis, not usually by itself, but in making the diagnosis. But those offspring at 6 years had lower levels of vitamin D. And in a trial that was an open label trial, moms knew they were taking vitamin D, they knew the doses. In an open label trial of not a large number of patients, where vitamin D was given at 5,000 international units during pregnancy, 7,000 IUs during breastfeeding, and 1,000 IUs to the newborn infants in the first 3 years of life. There was a recurrence rate of autism in the newborn siblings was only 5% compared to 20% reported in the literature. So the moms in this trial were moms who had one child with autism already, and now they were getting pregnant for a second time. The point about breastfeeding, and we'll talk more about that, is that vitamin D is transmitted through the breast milk. So if breastfeeding was controlled for, these moms that were taking vitamin D during pregnancy, during breastfeeding, and given also to their newborn infants, had a much lower incidence than that reported in the literature. Again, this is a small, uncontrolled study, but it gave some evidence that was maybe anecdotal that maybe this could make a difference. Antioxidants have also been thought to make some difference, but there isn't a good study yet of antioxidants showing that it makes a difference in the outcome of pregnancy when given to mom during the time that the infant is in gestation. But neuroinflammation is implicated in the pathogenesis of neonatal brain injury. So drugs that reduce neuroinflammation, like antioxidants, may prove therapeutic for brain damage that might occur during this brain growth period. There's one study looking at NAC, N-acetylcysteine, which tends to scavenge and help with reduce oxidative stress in the CNS by replenishing glutathione. In a study of mothers diagnosed with chorioamnionitis, which means that the placenta was inflamed, found that NAC treatments increased the anti-inflammatory of IL-1, that receptor antagonist. So there was some sense that antioxidants could reduce evidence of inflammation, and one could then perhaps take that the next step to wonder whether it could make a difference if mothers might have an inflammatory process like influenza that could play a role in affecting brain development in their growing embryo that they're carrying in utero. Iron, as we've mentioned, contributes to neurotransmitter production, myelination, immune function, and is critical for early development. Dysregulation has been associated with the development of autism. The highest amount of maternal iron in a CHARGE study was associated with lower autism risk, especially if the mom was breastfeeding and that iron was also being transmitted in that way. Low iron intake, as we said before, interacts with advanced maternal age and metabolic conditions, giving rise to 5 times the risk increase of developing autism. Interventions that there isn't enough evidence to make a statement about, but there's anecdotal evidence to create interest, include things like iodine levels, choline levels, supplementing with iodine and choline, methyl B12, what role it might have, but again, as we said earlier, too much of that is associated with a higher incidence of autism, and other antioxidants might be considered and hopefully will become a rich area for research as we move forward. The most important postpartum factor that we know of that plays a role seems to be breastfeeding. Breastfeeding contributes to things like social recognition, bonding, neurodevelopment, particularly through oxytocin, and it's transferable to the infant through breast milk. So 7-month-old infants with autism and genetic variation in this CD38 gene that regulates oxytocin and social behavior found that increasing their breastfeeding duration enhanced a looking preference to happy eyes. They picked happy eyes and tended to look at that. Now, that by itself is not a strong evidence of preventing autism, but at least it shows that things like oxytocin and the CD38 gene seem to play a role in eye preference, in looking. Oxytocin also, which increases during lactation, reduces stress hormones and protects mothers from anxiety while those mothers are breastfeeding. And there's some indication that perhaps anxiety can play a role, maybe not in the full syndrome of developing autism, but in how that expresses itself and how those early epigenetic processes tend to do. So moms who are not anxious tend to be associated with better outcomes in their infants, especially if they're at risk for autism. And breastfeeding, as we'd mentioned before, also transfers these omega-3s, the long-chain PUFAs. It protects also against gastrointestinal symptoms, which are present in many children diagnosed with autism. And suboptimal breastfeeding is associated with a risk for autism, ADHD, and cognitive defects, which has been shown clearly in a number of studies, including recent ones. So I'm getting near the end of my talk. I have about 3 slides left, and I hope you'll be thinking of questions or comments that you might want to make or things that we should talk further about. But as one of my concluding slides, I want to tell you a little about a study that has weaknesses but is an interesting anecdotal study done in the practice of Elizabeth Mumper, who has a practice largely made up of families who have at least one child with autism. And in those families, moms would come to her saying, we'd like to have another child. We'd like to see what could we do to improve the odds that our second child won't have that 7 to 20% chance of developing autism that comes in the offspring when one child has autism already. So she made the assumption that autism could be impacted by environmental toxicants, breastfeeding duration, the flora of the gut, the nutritional status of the mom, the use of acetaminophen, and the use of antibiotics and/or frequent infections. So she set about with these moms to say, what we'd like to do is think with you about how to minimize the toxicant exposure, maximize the breastfeeding and the duration. She also used probiotics, and there isn't a clear study showing that probiotics is beneficial during pregnancy, but there are some studies suggesting benefit of probiotics in people with autism and particularly in mouse models of autism. Nutritional counseling, limiting antibiotics, minimizing acetaminophen use, and she discussed vaccine schedule, which was largely not don't get vaccinated, but think about how can we spread these out in the best way, don't get vaccinated if you're ill, thinking about how to do that, and that's something that each parent needs to do with their pediatrician. At the time her study was published in 2013, or just before then, out of 294 general pediatric patients from 2005 to about 2012, there were 0 new cases of autism in her practice. Other strategies that one might think of then, and that she suggested, was probiotics, vitamin D3, folinic acid, and omega-3s, which we've talked about already as being important. So there's a group that's begun to try and think about how to create a large study that could look at whether these kinds of interventions could improve the outcome for all mothers, but especially at-risk mothers of eventually having their child develop autism. This preconception to infancy group, whose website you see at the bottom of the page, had a conference almost 2 years ago, and a number of experts from around the country and most of the areas that we covered came to present information about what might be strong factors. And based on that, P2I has developed in their website a kind of, and is increasingly developing, a step-by-step guidance based on hard science that can dramatically increase a woman's odds of delivering a full-term baby who will not suffer from chronic disorders like ADHD, cancer, serious allergies, or autism. Their global idea, their grand idea, is to say that through this P2I initiative would be to positively affect 1 million babies' lives in 5 years, to enroll that many babies, that many moms, and say that the outcomes have been positively affected by following this. They've established a center, and I guess I keep saying there, I should say, full disclosure, and I didn't put that in the beginning, that I am on the board of P2I, but we're not a center, and the center is at the University of Georgia in Atlanta, just headed by Jose Cordero, who was previously at the CDC and has a strong research and practice background in looking at autism and at factors that might affect it. And they're going to open their doors the first quarter of 2017, soon, and their intent is to play a key role in ensuring safe pregnancies via this P2I best practices. You can go to that website and read some about what's happening, and that site is going to continue to grow and have additional information which will hopefully be useful. My final slide is from the Mind Institute. You might know that for 8 years I was the director of the Mind Institute, and was when the Mind Institute opened. And we had an art contest of people who had some kind of developmental disorder, and there was a juried show, and 70 pieces were selected to hang in the Mind Institute. And I have to say this one's my favorite. It's called The Haircut. And you can see how this little boy, who was 5 at the time that he drew this picture, and a boy who is now, I think, 23, and I still see him, how he was feeling about getting a haircut by the look on his face. And you can see this barber, and the bee was probably the buzz of a razor that was cutting his hair. His mom said that he'd draw pictures, draw things of uncomfortable situations, and he always showed an escape route. And here you can see this door. It was his escape route to get out of this uncomfortable situation he was in. I hope that by our thinking about these biomedical epigenetic processes, and think about things that we can do to make the body healthier and more resilient, we can not only improve outcomes in autism, but we can actually begin to increasingly show that we can prevent autism. Thank you for being with me today, and I look forward to your questions.
Okay, great. Thanks for that presentation. We've got some questions. So anybody who's listening, if you have a question you want to type in on the question section, that would be great. So we'll just start with those now. The first one, somebody wrote and asked, Dr. Hendren, if I were to prioritize, what are the very first 3 things that I should do if I'm thinking about getting pregnant? So if somebody was in your office and asked you that question, what are the first 3 things they might do?
I think about supplements, folic acid, and working with your doctor around the right dose of that for you. I would think of omega-3s and vitamin D as all things. It's hard to, I guess I'd also say make sure you don't live near any toxicants, that those are not in your environment, that you're living a healthy life and doing those kinds of things. But if you're going to say, what am I going to do, like taking supplements or doing other things for my health, I'd say those 3 things.
Okay, so the next question is, this is a mom who is thinking about getting pregnant, and she says, I'd like to have another baby, but I'll need IVF, and I would like to be part of a study before, during, or after pregnancy. So is there a resource where I could find studies that are examining this question right now?
Well, it's a great question because it does seem like IVF is at least thought to perhaps increase the risk of autism or maybe neurodevelopmental disorders, although the jury's not in on that. And I don't know of any place that's actually actively doing a study of that. It would be a good question to ask as you're searching for a center, but I don't know of anybody that is. Sorry.
Okay. The next question, so they're talking about omega-3s. You talked about that quite a bit in the talk. So they're asking about plant derivatives for people who are allergic to fish. So are those equivalent, or are there any specific ones you'd recommend?
Yeah, I think trying the different kinds of plant derivatives, krill oil, the chia seeds. There's those bars now that have the little seeds in them that have a number of my patients that are taking those that are with yogurt and seem to be helpful. I think there are a number of good sources. It's a matter of trying to read the label and seeing how much are you getting of the omega-3, but it's fine to not get them from fish oil sources. It's just harder to read the label and know how much you're actually getting. While I don't think there's any recommended dose for pregnancy, the studies that have looked at supplementing kids with omega-3s have usually used about 1 gram of omega-3s. Some people go higher than that to 2 or 3 grams, but most of the studies that have done, and we've done 2 studies of omega-3 with kids, and we've used 1 gram as our supplement. And then there's a combination of how much of the EPA versus the DHA you have, and those are the ones that add up to be 1 gram. And generally, it's a higher dose of the EPA than the DHA, in terms of how you add those things up to get to 1 gram.
Okay. So the next question, you talked quite a bit about antioxidants, and this person is asking about sources for that. So food sources, or are there specific supplements that are known to be great antioxidants that are safe during pregnancy?
You can look at, if you were to look up foods that are high in antioxidants, they're often dark green leafy vegetables. There's others that you can add to your diet that will help a lot with that. There are a number of supplements that help with as antioxidants. I just talked about NAC being one, and there was the one study of using that in pregnancy. We just recently completed a study for kids with sulforaphane, which is concentrated broccoli sprout extract, and several companies have started making Nutramax. There's one good randomized controlled trial that was out of the University of Massachusetts and Hopkins, looking at that, improving outcomes for kids with autism. It its major property seemed to be an antioxidant property. And in our study, we used metabolomic biomarkers that suggested that it was having an antioxidant effect in the people that it worked for. Methyl B12 seems to have an antioxidant effect, and in our study of methyl B12 for kids with autism, it seemed to have an antioxidant effect, and that seemed to improve outcomes as well.
Okay, great. Just have time for just a couple more quick ones. This parent is asking how much lead time before getting pregnant would you want to really start to work on nutrition and antioxidants and supplements? What would be the ideal if you had all the time in the world?
People often suggest somewhere between 4 and 6 months. I mean, obviously longer than that's great, but if you did that for 4 to 6 months in people that I've talked to and folks that are thinking about it, it takes sometimes longer to clear out and get the body as healthy as possible, but generally toxicants and doing other things like that can be done in 4 to 6 months. There's also some literature that suggests the amount of time that you have between pregnancies improves the outcomes. So I didn't report that study because it didn't seem fully strong enough to report, but there is a kind of wisdom that would suggest if you have longer between pregnancies, your outcomes will be better. So it gives you longer to get back in shape after your last pregnancy.
Okay, last question. You talked quite a bit about the benefits of breastfeeding, and you may have said this, but I've gotten the question twice, so maybe it was missed. They're asking about what's the ideal length of time, or what would be the minimum length of time for the benefits that you're describing?
I think in general it's something that you might discuss with your pediatrician around what their particular approach is, but most would say a minimum of 6 months and maybe going up to 1.5 years, but I know some families that have even gone beyond that. But I think it's somewhere between that 6 months to 1.5 years.